This meeting is live on Google Meet, YouTube, and Facebook. If you go to YouTube and Facebook, you just type Dr. Elvis J. Davis, YouTube and Facebook. You'll be able to find this ongoing live event. And for the Google Meet, we are sharing the link that you see on the message chat, so you'll be able to share with anyone who would like to join this tool. We appreciate everyone who has joined, and if you can, we'll be happy to if you comment your name and write to us where are you hearing us from, and we'll be able to greet each other. If you would wave your hand in the chat, we appreciate. Before continuing with this meeting, I would like to welcome Miss Mercy Copper, for leading us to the opening prayer so we can start. Miss Mercy, you're warmly welcome.
Let us bow. Heavenly Father, we come before you with heart filled of gratitude for the presence. We say thank you. We have come to say thank you for the life that you have given us to gather here tonight, this evening. We ask for your divine presence to be with us as we engage in our learning session. Grant us the wisdom to listen to one another with open hearts, seeking to understand everything that we does not understand. We say thank you for everything. May your word be filled with kindness and love as we go through our session. Give us the strength, give us the listening ear, so we'll learn everything that we doesn't understand. In Jesus' name we pray. Amen.
Amen.
Amen. Thank you so much, Miss Mercy, for a very beautiful opening prayer. Now I'm welcoming again every one of you to come listen and learn together with this cancer awareness event. And I would like uh, to read to you the objective of the Dr. Elvis Oncology Talk awareness events. The main objective of these events is to increase the public awareness and understanding of cancer prevention and early detection and treatment options as well, through engaging and informative visual materials aiming to encourage healthier lifestyles and proactive health seeking behaviors. This is a main objective of our Dr. Elvis Oncology Talk awareness event. And let me run quickly to a brief elaboration of this event. Uh, it's usually live on the last Sunday of every month through Google Meet, YouTube, and Facebook. So every last Sunday of every month, you can just find us through YouTube and Facebook. You just write Dr. Elvis J. Davis, and you'll be able to find the live event uh, at at 6 p.m. the Liberian time. And for the Google Meet, we'll be able to share the links so that you'll be able to join in Google Meet as well. So now is the time for me to welcome one of the representative from the Dr. Elvis Oncology team um, for for doing the welcoming remark. Let me welcome Mr. Theophilus Dolo for a welcoming remark. You are welcome, sir.
Okay, hello to all. This is the director for event planning. So you guys are highly welcome. It is at the Elvis Oncology Talk where we lecture on mostly on cancer. Well, we lecture every month at the end of every month. We discuss different type of topic about cancer. So you are welcome. Be with us so that you can learn at least to help other people that been to more so that they can know about cancer. Tomorrow you are working as clinician. The goal is so they can get the hint on cancer, not to treat cancer completely, but it will be able to identify it tomorrow so that a lot of people can get killed at least to live on and live a healthy life. So they just bring us again. Thank you.
Thank you so much, Mr. Theophilus Dolo, uh, for a welcoming remark. We appreciate. And now is the time for us to welcome the presenter for tonight. Our presenter tonight will be Dr. Elvis J. Davis, and Dr. Elvis J. Davis is going to present to us the main topic of today, which is the cervical cancer awareness. So, Dr. Elvis J. Davis is the holder of Bachelor of Science in General Biology from University of Liberia, and is a holder of Bachelor degree of Medical Doctor in General Medicine from AMWT College of Medicine in Liberia as well. He is currently a MMed candidate pursuing master's degree in clinical oncology, emphasizing on radiation oncology at the Muhimbili University of Health and Allied Science in Dar es Salaam, Tanzania. Currently is a clinical oncology resident working at the Ocean Road Cancer Institute in Tanzania. And Dr. Elvis is also a lecturer at the University of Liberia in the Department of Biology. He's also a research enthusiast and a fellow of the International Atomic Energy Agency. Um, as our presenter is preparing to start the presentation, I would like to ask everyone to be able to switch off the mic so that we can be able to listen well to our presenter. And if you have any question or suggestion, please feel free to write it on in the message chat so that we'll have the time for question and answers and suggestion, and our presenter will be able to answer to all the questions. So, Dr. Elvis J. Davis, we are gladly welcome you, sir, to start the today's presentation. You are welcome.
Okay, thank you so much for welcoming me. And I'm hoping that I don't have the same trouble I had the other day again with my screen. It is great again tonight for us to be here. Like our moderator said, regularly during the course of the month, we usually have our discussion that focuses on varieties of cancers. And this month we happen to be the month for cervical cancer awareness. So we're gonna have our discussion specifically focused on cervical cancer. But at this point, I will I will like to switch a bit because I'm having issues
with this
with this
PC.
PC.
I would like to
So I would
switch a
like to
bit.
switch a bit.
And probably we
And
can just
probably we can
hold on
just
for a
hold
while,
on for a while,
and then I will
and
switch
then I
to
will
the
switch to
next.
the next.
Sorry for the
Sorry
technical
for the
issue.
technical issues.
But yes,
But yes,
as we continue
as we continue
to work
to
on the
work
technical
on the
issues we're
technical
having,
issues we're having,
I would like to
I would like
encourage
to
each and every
encourage
one
each
of
and every
us
one of us
who have
who
always
have always
been a part of the
been a part of the
process
process
to
to
see
see how
we
we
continue
can
to
continue to
mobilize
mobilize
to get
to get
others on board,
others on board,
because
because
the
the
discussion about
discussion
cervical
about
cancer
cervical
and
cancer
other
and
cancers
other
that we've been
cancers that we've
discussing
been
over the
discussing
period
over
of
the
time
period of time
is of
is of
real
real
importance,
importance
because
because
it
it
contributes
contributes
to
to
the
the
possibility of
possibility of
survivor
survivor
in
in
whoever is
whoever is
affected.
affected.
Notwithstanding,
Notwithstanding,
it is
it
also
is also
very
very
important
important
to
to
the survivor,
the
to
survivor,
the
to the
outcomes of
outcomes of
those
those
affected
affected
by
by
this
this
disease.
disease.
So each
So
time we
each
come
time we
to
come
make
to make
awareness,
awareness,
it is
it is
intended
intended
to be able to have us providing information to people that will help to ensure that the mortality that is associated, the high mortality that is associated with this disease condition is reduced. Not You are not hearing me? Sorry, I had it on mute. So I'm having a low issue here. So maybe we can just hold on for probably at least 5 minutes. Let me sort it out, and then we are good to go. We have some technical issues. Let me sort it out quickly, and we can go. Just a minute, and then we are good to go. Okay, 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 okay. Sorry, sorry. This technology, and sometimes we change realities. It's possible to avoid people trying to join, so that they will not be left out of the presentation. It gives us another difficulties along the way. Howbeit, we're going to accept it and we'll proceed. Let's just be a little patient.
Yeah, it's still giving us the same thing. Yes, so I will use this computer. So as I was saying, these awarenesses are important because with the knowledge we gather from here and for the other preceding awarenesses, it helps to provide the information that are needed, that just in case we have someone who is in our environment who might be experiencing these specific conditions, we can be able to have them to seek medical care at the soonest possible time. Do we see the screen now? Okay. So, all right. It has been a lot difficult for us here. Do you still see my screen? Okay. Are we seeing now? Can we see the screen now? Okay. So now before I proceed, the at the at the screen, is there anything covering the PowerPoint? Can you see the PowerPoint clearly, or there's a dark shield covering it? It's clear, right? Okay, great. Now it has come to a point where what we're trying to avoid, it have to repeat itself because. So now, thank you again, and I'm sorry for the difficulties we had, and actually there's nothing else we could do because we tried to sort it out earlier on, but then situation changes again in another way. But tonight, having to be January 25, 2026, and our discussion, this is our ninth virtual cancer awareness, and we are discussing cervical cancer and the most basic, which is of the general public knowledge, is what we're going to be discussing. It is not in depth as a cancer specialist or as a medical practitioner who is going to treat cancer, but we are providing this information that you can be able, when you identify these signs and symptoms in a person, you can easily be able to either provide them the pieces of advice to either seek medical care, or you can be able to refer them to the appropriate facility to be able to seek early treatment, because early detection saves life. So this is going to be our outline for tonight. We're going to take a little time to look at a basic introduction, and then from there we will proceed to look at the epidemiology and some basic anatomy of the female reproductive system, and then proceed to the causes and risk factors, and then signs and symptoms. Not only that, we're going to also look at the preventive measures, the screening methods, and then diagnosis. From there, we go to treatment options, and we call this a day. Theo, before I proceed, you can kindly tell those who are trying to join, because we still could not succeed with the prevention of these particular difficulties. So those who are trying to join and are unable to confirm them now, kindly tell them to join us on Facebook or on YouTube. By the subsequent time, we're not going to have this problem. Thank you. So for our introduction, cervical cancer, firstly we say, what is that? What is cervical cancer? So it is simply put a cancer of the cervix. And somebody will say, but what is this? What is the cervix? And the cervix refers to the lower portion or the lower part of the female womb. We say uterus and commonly say womb. And who are those that are affected by this disease? Who are those that are actually affected by this disease? And it is actually women, and we say probably anyone who has cervix. And to my knowledge, the only people that have the only individual who have cervix are female. So females are mostly the one that are affected. And why do we really think that awareness matters? Awareness matters because, for instance, you take a look at this the annual death rate globally, about 300,000, death rates occurring yearly. So early detection, as we go on with these awarenesses, it enhances or it promotes the idea of early detection. And then, of course, when there is early detection, it obviously leads to life saving. So awareness would be the one that will actually lead to prevention, because as we say about this one, somebody will know what are the best steps to take. You'll be able to move on to be able to go for cancer screening, the specific screening methodology we're going to be looking at later on this evening. And when they start to experience these signs and symptoms, they easily will go to a health facility and then to seek medical attention. So I want us to, at this point, to realize that cervical cancer is largely preventable and it is treatable, but that is when if it is detected early. So if it is detected early, you will see that it can actually be treatable. But late presentation, as we have repeatedly said in our previous presentations, it is difficult to be treated. So we take a look at the epidemiology. Globally, cervical cancer is considered the fourth most common cancer in women globally, with an estimated new cases or incidents of 660,000 per year and 350,000 deaths occurring yearly. So now in Tanzania, we see that about 10,241 cases occur by the time of 2020, and then 6,525 deaths are recorded. So the highest burden is usually among women within this age range, and the biology explained that because usually when people are younger, their cells have the means to repair those damages that occur to their DNA, because you go through stress and go through various processes, and because we are complex individual, the the DNA processes will experience damage. But when the female is much younger, they have the ability to be able to repair those DNA. But over time, some of the ones, those damages that have occurred was unable to be repaired, and it started to compile over a long period of time. So now you will see that around these ages now, where the repair mechanism for the individual reduces, that's when now these conditions sets in. So this is why you see the burden is usually within this age range. And we see the mortality here. And the survival is in such that the 5-year survival is usually 68%, but it goes up as far as 90% if there is early detection. What do we mean by 5-year survival? It tells us that from the time of diagnosis of the patient to the time that the patient will actually, we say, more like died, it has been estimated on the average at 5 years. So if and only if the person was diagnosed at a later age, so you see that that's at a later stage, maybe stage 2, stage 3, like that, or stage 4, you see that sometimes it even might go below this 68%. So it means that the possibility or the probability of that person living for that 5 years, the chance is 68%. But if the person is diagnosed earlier, at an early stage, the chance of getting to that 5-year survivor is about 90%. 90%. So you know 90% how it is like. So there's a high possibility. Now, usually you see that 90% of the cases and death occurs in low and middle income countries. Around low and middle income countries are the main area that you have most of the cases and death occurring. But if you see here at the far left hand side, there's in high income countries like the Western world and other countries, there's a declining rates in the occurrence of cervical cancer because of the screening, prevention, and things like that declining. While on our far right hand side, low and middle income country like LMRC, where you see that it refers to low middle income countries. So there's a high incident and high mortality because majority have access to screening. Majority of the people do not have access to the preventive measures like the vaccines that we're going to be looking at later on. And majority of the people that are affected, they present during the time of the. So now we come to that cervical cancer in the area. There's a paper that has been published back from 2020, but published the research was done beginning from 2020 up then, and then it was published in 2025. It estimated that about 639 new cases occur. I think you see here, and then the incident rate was 26 cases per every 100,000 women. So every 100,000 women you get, you have a 26 of cervical cancer in this population. So you see how it is that the rate is actually the incident. Now take a look at the incidence and the mortality. So the incident is just like the new cases occurring, and the mortality referring to the death. So the death in 2020, this was the estimated death in 2020, and it is one of the leading causes of cancer death among women in Liberia. Cervical cancer cancer death in Liberia. Now we take a bit look at a historical context, 1990s to the 2000s and up to then. So there were the most common cancer during this time in the 1990s was cervical cancer. In 2000, the top cause of cancer death. So the most common cancer in the 90s was cervical cancer. But in the 2000, it became the top cause of cancer-related deaths among women in Liberia. And then in 2010, it became a major health concern in the health sector. So we continue with it. Incidence and mortality. This was the new cases that occur, and then this is the incidence, and of course the death that occurs in 2020. And this is just a repetition of what we're talking about. And we say high death rate is due to limited screening, as we say, initially screening and treatment. And then the highest rate, it is usually in sub-Saharan Africa. So let's take a look at the anatomy of the female reproductive system. So this whole structure is not strange to us. We have seen it several times, including people who have had their biology classes and things like that. We know this is the female reproductive system. Here include the fallopian tube, the ovaries here, and then this point here, this lower part of the uterus here, that's the cervix. This is the place that the cancer develops here. So this is the lower part of the uterus. It connects to the vagina. It allows menstrual flow and childbirth goes through there. Now, if you take a look at this one, this is the normal. This is how the cell looks like. Normally appear normally, and you compare from the far right to the far right, as you see here. I think you see difference in the appearances. So this is how the normal cells occur. But then when the cancer turns to establish in the female system, the cells become abnormal. They appear abnormally, like the arterial structure and so forth. As end result, their ability to be able to travel from the place they are to distant parts of the body, it becomes high. So that was a bit his anatomy of the female reproductive system. So then we'll take a look at the causes and risk factor for cervical cancer. So the most common cause of cervical cancer, there might be other inflammatory processes that can occur, but the most common cause of cervical cancer is we usually hear HPV. HPV, it is human papilloma virus. So the HPV represents the human papilloma virus. It is the primary cause of cervical cancer in women. So now you take a look, later on you'll get to see that the various method we use with diagnosis and things, you see them that they will focus on these particular things. But let's take a look at this line. You say the human papilloma virus is transmitted mainly through sexual intercourse. We will now look at the risk factors here. If a lady starts to have sexual intercourse or sexual activities very early, like I said from the beginning of my discussion, I said that we are much younger. Our cells have more ability. Before I proceed, let me confirm as whether people are getting me. Are you getting me? Okay. When we are much younger, our cells have more ability to be able to repair the damages that occur to the DNA. But then, when we grow older, the chance or the likelihood or the very mechanism that can repair the DNA, it start to fade. It start to fade. So if the person starts to have sex early, and then they start getting exposed to the HPV virus, so it will start like repeated repeated infection. So each time that virus will interfere with the DNA and cause DNA damage. And then some of them will be repaired and some of them will not be repaired. The ones that do not repair, they will start to pile up. They start to pile up. They start to pile up. So you see now, when the person grows to a point where that the damage have accumulated to a particular amount. If you remember our previous discussion, we said cancer can come out of a loss of control, like when you're driving a car and then the brake and the accelerator, then the brake fails, only the accelerator working. That's the case with the cancer. So when it reach that threshold where you see that it is difficult for the repair mechanism to occur now, wherein if the cell is supposed to go to the next stage, but it is not prepared to go, the cycle will be arrested and the cell will not go. But at this point now, when all of these damages have compiled over a period of time, what happens now? The control will be lost. So when the control is lost, coupled with the fact that we are old and our repair mechanism has reduced, then that's the time the disease starts to set up. So when a person starts to have sex early, is a risk factor. Somebody having multiple sexual partners, because even if you start late and you're having too many sexual partners, what happened here is that person, one of them also might not be the actual cause, right? But they might go to somewhere else who they encounter another lady who have already been infected by another guy, and then they will take that virus and go back to the next person. So when you have multiple partners, those partners would then come from everywhere because everybody, the world how it is, back and forth, back and forth. So repeated infection again will lead to that. So multiple sexual partner is one risk factor. Another one is cigarette smoking, because the nicotine in this one interfere with cells integrity as an end result. smoking is also a risk factor. And lack of screening, you have never screened in your life all through until you are in your 30s, 40s, like that. It is a risk factor. You don't know the status of the cervix as to whether the cervix is safe from the pre-malignant lesion, infection by the don't know. So it's a risk factor also. So there are some facts and about cervical cancer. First, the fact is that HPV can affect anyone who is sexually active. That's the fact about it. Whether you're 14 years old, whether you're 15 years old, it's not going to, okay, this person is young, so I'm infecting this person, I'll go for the people that are older. No way. So long you start to have sex and you are maybe 10 years, you start to have sex, God forbid that should not happen. And you have 11, 12 or 13, 14, 15 years, you start to have sex. And you encounter somebody who is a carrier or who is having that virus, you'll be infected. So that's the fact about it. It is not about age. So then the myth is that the only people that are promiscuous are the only people that will get the HPV. That means only people that we say in our common word, people who are useless, are the only people can get cervical cancer. It's not true. That's a myth. So let's discuss it now. What if this lady is committed to a single guy, but then this particular guy is not committed to this lady alone? Does that make her to be promiscuous, to be useless? No. So that's the myth about it. Because this is the thing that makes people, our ladies, to be shy and shame to go for screening. Because the stigma that when you get cervical cancer means you are doing plenty man business all around the place. Sorry, I'm going more like into being more Liberian. So you are involved with too many sexual activities. Too many sexual activities you are involved with. Because of that, you got the virus. So this is a myth about it. So it's a possibility that somebody can be committed to, a lady can be committed to one guy, but this guy is not committed to one lady. So as an end result, this other lady who has been infected by another guy, he will go there and then take that virus and bring to this poor lady who is not promiscuous, who is keeping herself only for him. At the end result, she comes down with a life-threatening condition that reduces her lifespan. If she's supposed to live up to maybe 70, 80 years, it reduces that because the time you get diagnosed is about 5 years that you have to survive. Like all cancers, it's not only this one. So, getting cervical cancer does not mean, or getting human papilloma virus does not mean that you are useless or you are promiscuous. That's a myth. And so we now go forward. Early stages, we look at the signs and symptoms for cervical cancer. Now here we'll start from the top here. This person is not seeing her period. She is not having her regular menstrual flow, but then she starts to have blood from the vagina. So that means it is abnormal. So abnormal bleeding, it is one of the signs or symptom of cervical cancer. Another one would be pain during sexual intercourse. You're having sex and you know yourself that before then when you're having sex, even if the guy is rough or so like that, but you never use a feel pain like that. But then at this time that you start to feel pain, when he hit in the G spot, you start to feel pain, So with that, it is a sign also that something might be wrong. And if a person, any of your friend, or you as an individual, you experience this kind of issues, the first thing you need to do is that to try to identify a particular environment. Environment, I'm talking about health facility that you can be able to visit that are carry out cervical cancer screening. You go and do your screening. And if it proves negative, maybe probably it might be a result of something else. But if it is proven negative, then the next step is to get to seek medical care to the appropriate health facility that is capable of providing oncology treatment. Another one is you having unusual discharge. You go, you do your urinalysis and things like that. It's not about you having unusual discharge coming, foul smelling, very, very foul smelling, unlike maybe the fungal infection that people might get, you know. So when these ones also happen, it should raise concern that something is wrong somewhere. You need to go for screening. Don't be shy. Don't be ashamed. Like we said, the myth and the stigma that make people to stay away from screening is that when you have human papilloma virus, it means you are promiscuous. No, you are not promiscuous. Another one will be pelvic pain. But at this point, it means that there might be, metastasis to the bones and things like that. So that's the time you might start to experience this kind of symptoms. So usually in the early stages, these are the ones you experience. The abnormal being, the unusual discharge, and sex during sexual intercourse. These are the most common ones I actually experience. Now we move forward to the prevention of cervical cancer. Cervical cancer prevention, we broadly divide them into two. That is the primary prevention, the ones in the orange here, and then the secondary prevention, the ones in the green here. So primary prevention, what is the primary prevention? What are these? So the primary prevention, one of these is the HPV vaccination. In Liberia and even in Tanzania here, there is a program, a vaccination program that is currently ongoing. I heard about Liberia and people were having myth about it. There were lots of things, and even Dr. Subu decided to talk about, to make some clarification with regards to that. And I was also speak in that same direction this night with regards to the HPV vaccination. And I think you will hear that from the people they were vaccinating young girls who are from the age of 9 years and up to 14 years. And there's logic in that, and there's a reason for this. The reason is that just try to retrospect on my explanation about when we are young, we are having a better chance to repair DNA. But then when we grow older, we have less chance of DNA repair. Now, the one of the reasons for which they are targeting ladies or girls of the age range is that the expectation is that somebody between the age of 9 and 14 might not have really got themselves involved with sexual activities. So what they do is that they try to do the vaccination so that they will prevent before they reach the age of sexual. They have already taken a vaccine that creates immunity against the virus, so that whenever the virus enters the system, the immune system will identify it and then contain it, and then clear out of the body. So the reason is that we now wait for you to start having exposure to the virus before we say we want to give you the vaccine. So we target these people who are not already having sex. We protect them so that even when they come at a point where maybe they are committed to a particular guy and the guy is not willing to be committed, they can still be able to prevent themselves of reducing their lifespan. So that's the reason why you see ladies, young girls, were as the target of the vaccination. And the vaccine comes in 2 doses. And the studies, there was an article that was published from the same WHO. I read that in Liberia, there have been about 242 around such number young ladies that have been targeted to get the vaccine. And out of that number, about 30% of them, about 43% of them have received the first dose of the vaccine. And then out of this, about 30% of this total number, about which is the 2,000 young ladies who have been targeted, about 30% of them have received the 2 doses. So the vaccination, the HPV vaccination, is part of the primary prevention. So because HPV is the main cause, so the vaccine can be given to protect against them. So and the assurance is that the vaccine is safe and it is effective, and it is recommended for girls, young women, and in some settings for boys. But I have not come across the actual backing for this. We're going to make research, and then in subsequent time, we're going to provide the logic behind this one. So another primary preventive measure is safe sexual practices. One is that you should limit the sexual partners. If not, you can use condoms, and also you should delay sexual activities. You should not start to have sex early, or if you are having sex and you don't trust the person, you feel like the person is here back and forth, you should use condoms. Sexual partners. Smoking cessation, you should reduce smoking. You have to quit the smoking because it helps to fight against the HPV. But if you are smoking, the ability of the body to be able to fight against this one, and then because, like I said, it reduces the cell's integrity. So the integrity of the cells to be the immune system to be able to counteract the action of the HPV virus, it reduces in smoking because of the nicotine content in this and other carcinogens contained in this cigarette. And then so when you cease, the risks of such will reduce, because smoking is not only restricted to this one. There are other cancers that smoking can lead to, and smoking is not only this cigarette with shisha is also a part of smoking. So kindly be aware of that. So now we come to the secondary prevention. The secondary prevention, the first one here is regular screening. So you see, the primary prevention, you talk about the vaccine, the sexual habits, and the cessation of smoking. And the secondary prevention now is what we talk about, the regular screening activities. So we say you can do your pap smear, and you can do the HPV testing. So you can do the pap smear. The pap smear is different. That's where they will take a portion of the cervix and things like that, and then they go through cytology process and then do the study. But then you can also be able to study the HPV virus, the DNA, to see as to whether it is there or not. If it is there, that means this person is infected, and the best measures can be put in place. Another method of secondary prevention is a visual inspection. The visual inspection will involve the use of acetic acid, where you go and then the female will go in and then they make a specific preparation. They apply the acetic acid with some other components or some other substances on the cervix, and there can be discoloration. Specific discoloration can occur, and when this discoloration occur, it can tell you as to whether this person is at a higher risk or is infected by the HPV virus, or they have cancerous lesion. It can tell you or not. Another one is the leukoiodine. So the acetic acid and the leukoiodine are the method you can use for the preventive, that's the visual inspection. So you can also prevent, so this method prevent most of the cervical cases. Now, follow-up care, you go on afterwards, the abnormal results needs further testing. So if you go for the inspection and then there was abnormal finding on the inspection, you need to go for further testing, which will include the pap smear and the HPV DNA testing. Then also with this screening, it can help to start early treatment, because I told you when these ones are positive, then you can better start treatment early, and then you keep up with your appointments. Now we come to screening and early detection. So, but why does screening, what does screening really mean? What does it mean? Screening is such that you're not waiting to get sick before you go to the hospital. You are well, nothing happening to you, then you go to the hospital. So you're looking, like you're looking for it. You're looking for it around. It's a kind of medical term for maybe we say chichipole or whatever it is. But it's a medical term we use. You are trying to deep deeper. You're trying to deep deeper to be able to inquire if whether there is something. That's why you see they put a microscope here. So you are checking for early changes, not cancer, but can turn into cancer. So you're checking for things that they are not really cancer by that time, but after a period of time they can change into cancer. So that's what the screening is. It can help to find problems early, and then the best solutions can be put in place. So why screening is important? Why? Let's look at it. So early cancer has no symptom. So when the cancers are they are at the very early stages, there is no symptom. So you will not know. You be moving, you feel like you're okay, everything is fine, and things like that. So there's nothing bothering you. But it's there, it's growing. And before you look, when that is uncontrollable. So screening is important because it will help you to detect that condition and handle it so before you lost your life. So screening cancer. So regular screening will actually save life. So it's not like you screen one time, then you had you're done with it again. We're gonna provide the um, a time where you're gonna see how many time because usually it should be like annually like that. When to start screening and how often? When it begins in adulthood, it should be regular. It depends on age and the guideline for the particular institution and the health system. So the type of screening, the pap smear, the HPV testing, the visual inspection, like we just spoke about it earlier on. Now, what happens if a test is abnormal? What will happen? This could be a question that will be running to somebody. Man, what happened now if I go for the visual inspection? Then the test determines the test is abnormal. What can I do? Actually, it does not mean that there's cancer. It is cancer. So you need to go for further testing to prove that yes, of course, this is a either precancerous or it's a cancerous lesion, and it leads to also early treatments that will prevent the cancer. You can be able to you can start early treatment, and which of course will prevent the occurrence of cancer. Now we come to the diagnosis of cervical cancer. How is it diagnosed? What happened after the abnormal screening test? Abnormal does not mean cancer, like I said initially. So more tests are needed and follow up to confirm the abnormal cells and gas with gas treatment. So the follow-up test, after you repeat the screening, you go for close examination, and then they will take tissue they take tissue biopsy, they carry it for the pap smear testing, and then for the HPV DNA testing and things like that. So you see, I will say biopsy. So they will remove small amount of tissue. They will examine it under the microscope. Best way, this is the best way to confirm so whether the cancer or it is precancerous. But the one you see with the inspection, the visual inspection, it just tells you like, okay, this particular place is at risk of getting cancer, but it does not tell you that. Somebody cannot go in and tell you you did the visual inspection and the person tells you you have cancer. No, you need to go for this test. So this is why these awarenesses are important to make us to understand what are the things. Because somebody will go somewhere and then they just tell you, somebody see you and tell you, okay, you got cancer. Have you done the test, the necessary test? Even though it should serve as a warning to you, but does not also mean that you have cancer. So because it can lead to anxiety, depression, and other psychological impact. So it requires you to make the best to make further investigations. When the laboratory tests have been done, where they do the biopsy, they study the tissues and then things like that, and know as to whether they agree yes there is cancer. The next thing they need to do, they will do imaging like the CT scan, the MRI, the ultrasound, the chest X-ray. They can do these ones to see because, like I told you initially, when the cancers when the cancer, the cells change like that. When the cell change, they have the ability to leave from where they are to go to other parts of the body. That's what we call metastasis. When you hear metastasis, that's what it means. So the cell were in point A, it has left from point A and gone to point B. So if to find out as to whether this has happened, this is why we do these visual imaging studies. Yeah, like you see here, there's an example of an imaging. It could be the CT scan machine here, also the MRI you see at this point. Now, treatment option, we almost to complete. Treatment options, it actually depends on the stage. So, the treatment can include about, we say, about three modalities. Three modalities. Not only that, it involves a multidisciplinary team because you need a pathologist, you need a surgeon, you need an oncologist, and the oncologist, you got a radiation and medical, even though some of them can be both medical and radiation, which we refer to as clinical oncologist, but you have a multidisciplinary team that will be working together. And you even need also, you need a physician like the internist, because there are some of the medicine that can cause different conditions, even though. So when you will need this disciplinary team to be able to work so that you can tackle all of these conditions at different points. We'll say initially it depends on the stage. So when it is in the early stage, usually that surgery can be done. You can do surgery, you go and cut that part of it from there, the part of that surface that have that cancer, you cut it from there. But that's when it is early. We say like stage 1 and things like that. Sorry. It's like stage 1. But then when it goes to stage 2, stage 3, and stage 4 like that, that's when you have different modalities coming in. So maybe we say stage 2, stage 3, maybe early stage 3 or stage 2, like stage 2, stage 3. You have chemotherapy. The chemotherapy are the ones, the medicine that you can give sometimes in the vein, even though they got some chemotherapy can take by mouth, but they usually will give in the vein, and somebody can go under the skin and things like that, in the other part of the body. So these are the medicine that we give. So they can give you that along with the radiation. So the radiation, just the way you see the X-ray or the CT scan, almost the same type of energy that can, even though for the treatment it can be it can be much higher as compared to what we use for the investigation or for diagnosis. That particular light, that current or that light is what they will use and point it, but it is well controlled, well demarcated, and we go through a lot of planning to ensure that before we give that particular radiation. So they will go and demarcate, they place the cancer area, they will firstly go and do the patient, they will scan them, they will call it simulation. From there, they will go and prepare how that particular radiation will be given. You see here, high energy X-ray. And then it can also be something, it can go internal also. So the treatment will involve, they give you the chemotherapy and then they give you the radiation therapy. So you can start most of it in cervical cancer, you can be given a chemotherapy and a radiation together. But if it is advanced now, sometimes choose between these two, because even if you give the both of them, it will only help to reduce the patient quality of life, but you're not going to add any benefit to the patient. So for the surgery, there are a few things you can consider as whether this lady still want to have children or not. If you don't want to have children, sometimes they will do hysterectomy. That means they will take out the womb. But if you still want to have a child or children, then they can just cut portion of the cervix. But usually, sometimes if the right tests were not done, sometimes it's a high risk of recurrence. But if they move the entire womb, and then they did test, the cancer did not spread to any part of the body, you are free. But if you maintain the wound there, and maybe a small portion of it went upward, and then the test did not pick it up, there's a high chance that it can recur. So these are the methods you can use. So again, to recap, there are 3 specific modalities. You can use surgery, you can use radiation therapy, and you can use chemotherapy. Sometimes also there are immunotherapy that can be given too. immunotherapy, but I will combine that one under the chemotherapy methods. So we just say three modalities here you can use to when you are treating the cancers, cervical cancer. So our takeaway is that cervical cancer is preventable. Most of the cases of cervical cancer can be prevented through the HPV vaccination, regular screening, and early treatment of precancerous changes, and prevention will actually save life and protect future generation. Because if the lady does not survive, she is not going to be able to produce future generation. So the HPV vaccination will save life. Encourage our girls to take the vaccination. It is safe. There are two doses. Let them take it. It is safe. It is recommended. It is effective. And early treatment highly effective when the cancer is diagnosed at an early stage. Screening detects early and it leads to early treatment and improve survival. Thank you so much. These are our references. Thank you for having us tonight. And we pause here for question. Moderator, I turn back to you. Mm-hmm. So, okay, the symptoms we said initially, the person will have abnormal PV bleeding. When we say PV, it means per vaginal. They will have abnormal per vaginal bleeding. They can have abnormal discharges per vagina, not anywhere else but per vagina. And then they can also have pain during sexual intercourse. These are the most common symptoms. That is when the disease is locally advanced or it is just restricted to the the um, the cervix. But the symptoms improves if it becomes more based on the other part of the body the cancer spreads. So if it spreads to the lung, the person will have difficulty breathing and other things like that. If it spreads to the bone, the person will have bone pains. If it spreads to the liver, the person is going to have liver abnormalities. You see that the maybe albumin and other things level will go low. Maybe the person might have obstruction of the bladder, which can lead to possibly jaundice and things like that. But usually in these cases, it's not so likely, but there will be abnormal liver enzymes and things. But those ones are not really symptoms, but mainly the symptoms will be where you have the bleeding, the discharge, and sexual intercourse of like pain that you feel. Yep. Well. Um, if and only if I should be the person to advise um, a lady to be able to involve themselves with sexual intercourse at which time. I think first thing I will tell you is that you should graduate from college first before you have sex. Because at least if you graduate from college, you know how much or what will be your age at that time. So graduate from college for before you have sex. But it is not common in Africa. It is not really possible in Africa. So because of that, I'm seeing somebody laughing. Because of that, we expect that at least you should be in your late teens, maybe around 18, 19, 20s, like that. That's the appropriate time. But when you below then, like for instance, you are a juvenile, you below age 17, 16, 15 years old, it's not appropriate because you are exposing yourself more early to the risks of developing a disease that will cut your life short. So it's better you, I would say, you graduate from college first before you start to have sex. The target is usually people, it is usually young girls between the age of 9 and 14 years. And we said the reason is because we want to prevent, we want to protect them so that when they start to have sex, they'll be protected against the virus. So usually around that time. So when you at an upper age, usually the thing you need to be doing is to be doing screening. But the vaccine is usually for people younger. And that's the reason. It should be actually done annually. Annually means yearly. So um, the cervix have a specific histology, or let's say, let me not use that term because we are of the general public, but the cervix has a specific, type of cell that are prone to this malignant or this cancer changing ability. Because when you look at the cervix, part of it, when you leave from a particular point and come to a particular point, some of them they get different type of cell, and other than some of them get different type of cell. So the place they meet, that particular area, almost like, how can I give it in real word? If somebody has seen the mouth of the river at the point at which the ocean meets, the river meets with the ocean, the nature of the movement of the water is totally different from that point as compared to what happened in the river and or what happened in the ocean. The movement is actually different. So that's the same thing. That place where the two different types of cell meet, that area is the area that the cancer cell usually can develop because the cells have different ability, different integrity. So that's the particular point. It is not the case in the male. So because of that, they cannot get infected. For giving them vaccine, that's what I saw. Like I said, we had a point where it said boys should be vaccinated, but like I said, I have now followed up on that. But as it stands right now, the vaccination programs are mainly targeting those affected. Hope we can be able to see a way that we can lead into those who are carrying it to give it to people for them to be uh, vaccinated also. Okay, so the type is type 16 and 18. Usually, these are the types that are usually affected. And then also the portion, a part of the service is where I talk about, we call it transitional zone. That's the main area that usually they can be affected. That's where the disease starts from. And what was the second part of the question? Kindly, somebody is saying their hands are up. Look at those whose hands are raised so that you can have them to ask that question. Maybe they want to speak out. They don't want to write their question. So those whose hands are raised, you just ask them. What was the second question again? All right. Okay, that second one, yes. So what happened is that I would not want to explain that deep part of it because many people might not understand it. But let's just understand that um, when the virus infect the lady, it interferes with the DNA and cause DNA damage, and that which when it is not when the repair does not occur, it start to accumulate, and over time that will transform into that. So it usually it interferes with the DNA and cause damage. So yeah, so I responded to that. We said it's 16, 18. These are the most common types. Okay, so you said when pap smear is not available. When pap smear is not available, the visual inspection is the most uh, available. It is cheap, it is easier. That's what you can use um, for the investigations if the pap smear and the HPV DNA testing are not available. So just back to Justin. Justin, usually because there's a time frame in between from 1 to 5 years where you have to do this specific test, and I want to make specific references to them in between the age between the years of 1 and 5. So you actually see that for the HPV DNA, you have to have at least within the average years should be at least 3 years, at least 3 years. So it is much more recommended to do it more a little frequent, for at least 3 years for them for the pap smear and that the HPV. Yeah, so recommend everything. There's this roof tennis here is raised, but not go there. Kindly recognize them before we go to the YouTube. Your questions have been answered. Yes, I'm hearing you. Yeah, so when a person, when an elderly person is receiving the vaccine, that means, you know, uh, they have been cleared, because usually vaccines are meant for prevention, right? It's not for treatment. So, if the person was tested and then it showed that they are not infected, then depending on the age, if they are young adult or so, it is safe to give to them. Yeah, but people that are elderly, it is not going to necessarily make any much impact, because, like I explained about the biology of the individual, so it's not going to make any necessary impact. But people in the age range of such, at least once they are not infected, you can give to protect them from the infection. Sorry, no. If you are not doing any test to know your status, um, it is not advisable. It is good to have to do the test and be sure before, because if the person's already had the vaccine, and these vaccines have, they have um they almost, like, some of them are either RNA that can be taken and modified, or some of them they are the live viruses that can be taken and then modify, or they become they reduce the ability to cause infection and then introduce it. So when you already have it there, you might cause some other uh, um, processes that would lead to unfavorable health conditions. All right. I did not get that. Okay. Yeah, I understand. So it is the infection is something that accumulates over time. That particular or disorder is it occurs over time. It does not happen, um, just like the way you see the cause of maybe HIV or say hepatitis. No, it is not like that. That one, it has to be causing the damage, and then cause the infection be repeated, and that damage uh, keeps piling up over a period of time. So it's not like almost like the way you see when if Ebola infect a person and then goes on to cause harm. No, it is not like that. So what it does is that it interferes with the cell's integrity. That's what it does. So it is not really calculated on a basis of virulence. It is not calculated on that. For the fact that you get infected, it's going to cause a problem. Whether once you get infected, it's going to cause a problem. But it might not be abrupt. That particular issue will not be, detected just there and then. It has to take a period of time before it sets in. And let's be logical about. Let me just go back to Ruth. Let's be a bit logical about an elderly person who is already taking. Maybe a person is in their 40s or 50s. Now, we understand that first thing is the person needs to be sure of their status and other things. But aside from that, a person who is in their 40s or 50s, and considering that the development of such malignancy, it occurs over a period of time, because it does not just happen in a short period of time, occurs over a period of time. The target would be more preferable to go for the younger ones who have more life expectancy. They have time to give time for the cancer to develop, other than somebody who is, the life expectancy is not very high as compared to, let's take for instance, if a person is in her 50s, do you think they can be able to live for another 50 years so easily? It is not so possible. But if a girl is 9 years, you expect that she will live for additional 50 years, which will be, at that time, she'll be 59 years. So she will get more time to give for the cancer to be able to set in, for that damages to occur, and then for the cancer to develop. So if you give it to a person who is much older, that person, for them to live up to the time that damage, maybe for 40 years or 30 years before that damage sets in, over 25 years before that damage sets in, it's not so possible. Even though it's safe in them also, but it's not so possible. But it is not logical, because you'll be wasting resources. So it's better to target the younger population who will live for a longer period of time for the cancer to develop in them, rather than giving it to people who are already old, and the time they'll be able to live for until they die is not going to be appreciable for the cancer to develop in them. So as a result of that, it is better to go to the younger population rather than the older ones. That's just it. But you need to understand firstly the biology. Is cancer like Ebola? No, it is not. What For cancer to occur, the only time you see cancer occurring is when there are genetic or disorder that took place from the level of the genes before even that person was born. That's when you see those ones. Therefore, in the case of BRCA, the BRCA mutation and things, and at a particular point, we need to take a moment of silence to commemorate the passing of our colleague who passed off as a result of being diagnosed, and then the disease progressed to a point that she could not survive. Later on, we'll take a moment to commemorate her passing. So, like for instance, in such a younger age, you expect that there has already been an abnormal situation that occur from a very younger time, from a very early stage of that person. So if that is the case, then you can see that some cancers will develop at an early stage, even though they have cancers that occur in children, but there are some cancers that are specific to elderly, to age group. I think you saw the age range that we saw there between 40 to 59 years, because that person will live for a period of time up to their 40s. That's when those ones occur. So the people who are younger age range, maybe they're in their 30s or late 20s, and then they got a disease, it means that they started having sexual intercourse more early. So to ensure that you don't lose the younger population, you target them and try to screen and treat the older ones. That's the logic. Yeah, yes, that's what we're saying. Maybe if you want to do the HPV, DNA, and that of the pap smear, you can do at least, because we had a range, but usually you at least the average will be around 3 years like that. To a point of correction, it is not a virus that spreads. It is not a virus. The only thing the virus doing is that, how do I say? So, take for instance, a person is driving. Is that one? No, I won't make that example. All right, let's talk about the childbirth. During the time of the development of every one of us that are existing, we start as 23 chromosome, 23 chromosome we combine. Is it as if 23, is it as if sperm and egg will come out as when doing the delivery? No, it is a human that comes out, right? So the only thing the virus is doing is it is setting the stage. The virus is setting the stage for the occurrence of the cancer, but it is not the one that will be going to the lung, going to the bones, going to the liver. No. After it set the stage, the control of the cell cycle is lost, and the cell can go anywhere. Like for instance, you have children, and those children, their parents refuse to provide guardians for them. They will go astray. And when they go astray, you see somebody will go and contract this one, somebody will go and become an addict, and some of them will become good. So their path will be different. So once there is no control of the cell cycle, what happens is that the the um, the cell can divide any kind of way you want to divide, and the growth will not be appropriate. So because of that, it leads to cancer. So when those things occur now, the cancers now, those cells will change their identity. When they change their identity to a point where they can be able to go anywhere, that's when they travel. So it is the cancer cells that travel. It is not the virus that travel. So that's the point of correction. Let us let me just cut you in. I needed to do this before I start my presentation, but since that we are still here, let us kindly take a moment of silence to commemorate the death of our fellow doctor who died of breast cancer, though she is not yet buried. But let us uh, commemorate her life and her legacy. She was a strong person. She was courageous, but the aggressiveness of the disease could not be able to permit her to live as much longer. So let us take a moment of silence for her in remembrance of her. Okay, thank you. You can just give the emoji a clap for her. Let us clap for her and let her continue to rest in peace. I'll continue to rest in peace, and that we can be able to live after her and continue her legacy. All right, let's move on. Thank you so much to everyone. So, what happens when when the person, the male goes? So there are certain things about carrier and infection. So like somebody's a carrier, that means the person has it, but they're not infected. There is no harm that's occurring to them. So the only thing they can do, they can transfer it. Think about the mosquito. Why do you think the mosquito can get malaria, but it has the plasmodium? Why? So that's the same method. So the males can just harbor it and carry it. They take it because when you having intercourse with a condom, there will be fluid that will be exchanged. No fluid within the fluid, because viruses are much smaller. Even bacteria that mostly you don't see with your naked eye. Just think about virus, and the virus is much smaller than the bacteria. So they are in the fluid. So the fluids, they sweep their way into the tissues, and they find themselves getting stuck into the mucosa. And then from there, when this guy goes to have fun with his lady or whatever, he introduced his own fluid again will also be introduced, and at the end of the day, yeah, of course, the lady gets infected because she's the one that has cervix, and that she's the one that had a transitional zone that has a different characteristics of cell that can be able to transform quickly. That is the point at which the virus infect. That's why. All right, thank you so much, and I will join my voice to him to say sorry for the delay in the issuance of the certificates, but this time we're going to put in modalities to avoid the delays. And also, we discussed in our last leadership meeting, we are going to return to the printing of individual flyers for our awarenesses so that we can have more publicity. The program manager just posted his reminder about. I think he would like to talk about that himself. So Jimmy, if you are on, you can come. You can say a lot more about the um, the publicity. If not, then we can turn over to the moderator so that we can be able to end this one because we are in fact past 10:30. We have 4 minutes after 10:30 or 7:30 in Liberia. So it seems like he said we should continue. He said we should continue. So let's go on. Moderator can continue. we'll check it and then make our replies later on. We'll make the replies later on. Thank you all. Thank you all. Thank you all. Thank you all. Thank you all.
Crown upon my head, the essence of my life. God, you know me more. The queen were on my heart, the crown upon my head, the essence of my life. God, you know me more. You know me more. You know me more. Enough to go. I shall look over my mind. You know me more. You know me more. See as you smooth like silk, your voice like milk. Never lost an angel when you came to me. You're so amazing, baby. I have to say it twice. This love you give me so unadorable. Queen on my heart, the crown upon my head, the essence of my life. Lord, you know me so. The queen on my heart, the crown upon my head, the essence of my life. Lord, you know me more. You know me more. I shall look over my wall. You know me more. You know me more.